Hello, good afternoon. This is Dr. Didac Barco, dermatologist from Spain. Thanks for catching up this webinar, and thanks to Candela to promote this kind of educational events that I really love to do. We're going to talk about hypertrophic and keloid scars treatment with the Co2re and the Nordlys systems. All right, so there we go. Here is the webinar agenda. These are the three main points we're going to talk about. And after my speech which will be about 30 minutes long, we're going to start a Q&A time, which will be about 15 minutes. All right, so feel free to comment anything, or if you have any questions, you can write it. You can type it down in your window, and once I've finished the speech, we're going to answer these questions. All right, so first we're going to talk about the pathophysiology of hypertrophic and keloid scars, and for that, we're going to start with this flow chart. All right, so when we have a wound or a trauma to the skin, it starts to recover with the hemostasis phase, and it takes time in the first 15 minutes. We then go to the inflammatory phase, which appears in the first 6 days. We then move to the proliferative phase, which is in the first 3 weeks after the wound. And after that, we go to the maturative phase, which may take up to 2 years long. So what I want you to notice is that in the first 3 weeks, we do have different stars that appear in this movie. All right, so in the first 3 weeks, we do have blood vessels, we do have fibroblasts, and we do have collagen in the scar tissue. All right, and these molecules or these stars can be addressed using different techniques and different devices. All right, so for the blood vessels, we can use vascular devices, and for the fibroblast, we can use lasers that target water, that warm the skin, and then improve the collagen production. All right, so we're going to take a deep look at this flow chart in this next slide. So after the damage of the dermis, we see the neoangiogenesis and endothelial permeability that leads to an increase of inflammatory cells and factors, which promote pro-inflammatory genes that increase in fibroblast, and finally it leads to our collagen deposition. All right, and depending on how chronic this reticular dermis inflammation is, we can go either to a normal scar, we can move to a hypertrophic scar, or we can go into a keloid. All right, so if we take a look at what devices or techniques we can use to treat scar tissue formation, we do have these ones appearing here. All right, so in the very beginning of the damage of the dermis, we can use vascular devices to regulate the new vessels appearing there, and to regulate their permeability. We can also use intralesional drugs, cryotherapy, and we can also use fractional lasers. Okay, so these are the main weapons that we do have the first 3 weeks of the first 3 weeks time of the scar tissue. Okay, and we're going to discuss it in a more zoom in approach. Okay, so this is the rationale for early intervention. Because the main one, most of the parts of the scar tissue, they appear in the first 3 weeks after the wound healing. So we previously stated in the previous years, we stated that we only had to do the surgical scar revision in the first 6-12 months, but it's probably more than an appropriate in our current point of view. because the old point of view did not allow us to do any prevention to avoid hypertrophic or keloid scarring. Okay, so we can actually take advantage of each and every one of the chromophores that appear in the first phases of the scar tissue, the first 3 weeks. So we can regulate the scar tissue process, and we can do some prevention against keloid and hypertrophic scarring using these weapons written down here, the vascular lasers and the fractional lasers. So the current evidence recommends that we should take an early intervention with laser during the inflammation, proliferation, and remodeling phase. And I remind you that it is during the first 3 weeks after the trauma. All right. So intervening with these lasers in these previous phases, in these early phases, has the potential to reduce the cutaneous scar formation. All right. So we're doing right now what we call laser-assisted scar formation or laser-assisted skin healing. Okay. So we do not wait until 1 or 2 years to revise the scar, but we do take an active way to do regulating how this scar tissue is done. Okay. And the answer is, when can we start acting in a scar? So the answer is variable, and we do have different settings, okay? So one is as soon as the patient attends the office, because many patients still believe that during the first year after the trauma, they can do absolutely nothing with a scar. The other one, if we are the ones that suture or remove the stitches in a wound, we can actually act in that precise moment. Or there are even some papers that try to use non-ablative fractional laser even before the surgery, even before the trauma. Okay, so this should be the 3 panoramas where we can start acting in the scar tissue. The rationale of using combinations is based on the first slides I showed you. I mean, there are different chromophores, there are different molecules acting in the scar tissue formation the first 3 weeks, so we take an advantage of them, right? So to treat redness, we can actually use some lasers aiming to reduce the erythema, and to regulate neocollagenegenesis, right? And we can also use lasers that target water, so we can regulate neocollagenegenesis and try to reduce the probability of having a hypertrophic or a keloid scar, okay? So moving on, we're going to talk about what techniques to address scars. And it actually depends on at what time we do face the scar, okay? Because it's different if it's done before its formation or in the early stages of hypertrophy, and it means before the 6 first months or after these 6 months in the late stages of hypertrophy, okay? So if we are lucky enough to start the treatment before the formation of the scar, we're going to be preventing hypertrophic or keloid. All right, so we can use lasers the same day of suture removal of the stitches. For example, we can use the non-ablative fractional laser. The first 3 months, we can use the fractional lasers, ablative or non-ablative, but we can also use vascular devices because we will still have some erythema in this scar. And using lasers and other techniques are not against using topical treatments such as silicone, sheets, or gel, okay? So here we're going to see a recently removed basal cell carcinoma. This is actually immediately after the removal of a basal cell carcinoma. This wound is just stitched by myself, and after the stitching, we're just going to apply the non-ablative fractional laser, the Frax 1550. There we go. This is just immediately after putting the stitches. We're going to comment after that about the settings of the laser. This is the day after the removal of the stitches. I mean, the same day that I remove the stitches, I do the second pass of the laser. And after 1 month of the intervention, I do the third pass of the laser. All right, so it's just 3 sessions of non-ablative fractional laser within the first month after the surgery. Okay, so most of the times with this type of treatment, we avoid the appearance of a scar. Okay, so this is just the before after sample. This is a scar of 2 months evolution in the nose of a man, and this is after treatment using, sorry, I'm trying to move this window here, there we go. This is after 3 sessions using LBO laser, which is a 532 nanometers, using a short pulse neodymium yak and a fractional CO2 laser, all of them in the same session. All right, so the first session was after 2 months the injury, and then we made 2 additional sessions, 1 month spared each. All right, so this is the end result after 3 sessions. So we see the before, sorry, see the before here, and we see the after. Okay, this is we're going to talk now about the early stages of a hypertrophic or keloid scar. And when I mean early stages, I mean when they are in a proliferative state. All right, and we can deduce it just watching and touching the scar. So if we see a hard red scar and the patient tells that it's growing or it causes itch or pain, we're talking about a proliferative scar, and it is an early stage of this one, right? So what we should do in these stages is use a vascular device to reduce the blood flow that is feeding this scar. After that, in the same session, we do cryotherapy with a special tip. I'm going to show you this with a video, to freeze all the collagen fibers. And after that same session, we inject triamcinolone acetonide, 100%, no dilution, or we can mix it with 3 parts of 5-FU, 10 milligrams, 1 milliliter. Okay, so this should be the flow chart of how to act in an early stage hypertrophic or keloid scar. We'll see a video here. This is an early stage keloid. It's been treated before. This was the second session. So what we see here is still a red scar. This scar is causing some itch and pain. That's what the patient tells us, right? And we are now going to see the video. First, what we do is address the blood vessels with an IPL. This is the Nordlys PR handpiece. You see the vessel goes away immediately. We're going to talk about the settings of the laser. Don't worry about it. It can also help us with the melanin. These keloids, there we go, the vessel is gone. This is the first step of the treatment session. This is the second step of the treatment. This is a contact cryotherapy with this tip. This tip has the advantage that sends the freezing haze to the very deep tissue, all right? So it doesn't stay on the surface as the spray, so it does not blister too much and sends the cold to the very deep collagen, and that's exactly what we're looking for. All right, so first step is using a vascular device. Second step is using a cryotherapy with a tip. And third step is injecting, in this case, pure 5-FU at a concentration of 10 milligrams per milliliter. Okay? These were active keloids. You can see they are still red and they are thick. All right? And we're now going to see in the same patient an end stage keloid. It's completely flat. There we go. This keloid is completely flat. It's totally brown. It's no thick, and it has it causes no itch or pain. All right. So we use the 1550 in these cases at the very end stages of the keloid to improve the texture compared to the normal skin surrounding. All right. All right. So this was the second video. We proceed. Sorry. There we go. This is an example of a combination of treatments after a burn scarring. This patient attended our clinic 6 months after the burn scarring. Okay, so this is the before-after pictures. This patient was actually treated with 6 sessions of IPL or LBO laser plus intralesional steroids and 5-FU plus cryotherapy with a tip you saw in the video before, and finally a fractional CO2 laser using the deep mode with the core. All right, so this is one of the before-after pictures. You see the hand of the same patient after 6 sessions. We see the back side of the neck. See how the redness and the thickness and stiffness of the skin is really reduced with this combination treatment after 6 sessions. Each session is spared 1 month, just in case you wonder. This is the other side of the neck. See the dramatic improvement of this combination technique. And all right, we're going to talk about late stages in keloids. This is an old keloid, what you see in the screen now. And what is actually a late stage keloid? When I say late stage, I mean that it is inactive. So it's completely asymptomatic, and that would be the best sign to follow. If it does not cause any itch or pain, then it means this keloid is in its late stage. All right, so we can address with these techniques that we're going to talk about. It is normally also soft, it's brown, or it has the normal hue of the skin, and it's stable. So the patient says it's not growing or it's not causing any symptoms in the last few months. All right, so the first we should do is use cryotherapy, and if it has a lot of volume, if it's still a little bit thick, we can use intralesional drugs as the ones stated here, or if it has not much volume, we can go for the fractional CO2 laser acting in deep mode plus topical treatment, either a potent steroid or either 5-FU. All right, in a solution of this concentration. Forward. There we go. This is in the very beginning, a late stage keloid. This keloid was from many years ago. All right, it caused no itch, no pain. It was not growing. So we addressed it with cryotherapy plus intralesional steroids plus IPL or LVO, 3 sessions, 1 month spared each, and then we proceeded with just 1 single session of the core laser used in the deep mode. Okay, and this is the final result. I would not recommend to use fractional lasers in a keloid that is active. So in the early stages of a keloid, I would not use any device that heats up the dermis. All right. In my experience, and of course it's not evidence-based medicine, but in my experience, using fractional lasers in the very early stages of a keloid, it can even worsen that. They may get more active. All right, so first what we have to do is make this keloid go sleep and then use the fractional lasers. Okay, so I only use fractional lasers at the very end, late stage of the keloids. Forward. All right, so at the very, very late stage of the keloid, when it's just a macule, we can use the vascular devices, to take off the erythema, the redness, and then in the same session, we can use the fractional lasers with or without laser-assisted drug delivery. All right, we can use clobetasol propionate or 5-FU at this concentration. All right, and normally it takes just one single session. So the aim of this session is just improving the final texture of the skin to make it more even to the surrounding tissue. Okay. For example, this sternal keloid was first treated with 3 sessions of cryotherapy and intralesional drugs. And after that, once we got to flatten it completely, we made just one single and final session of the Co2re laser using the deep mode. And after that, we applied the 5-FU topically. There we go. See the video. It allows me. There we go. Sorry. All right, so we use the deep mode. Okay, 5% density of spots. And once I've done, we then apply the 5-FU topically. Right. Let's move forward. All right, so talking about the lasers and what settings to use with them, we're going to talk about 2 different devices. The first one is the Nordlys. So if we want to aim the vascular component of hypertrophic and keloids, we should use the PDR 5030 handpiece. If we see just diffuse erythema with non-visible basals, we go to a 1.5 millisecond duration of the shot, using 6 joules of energy. Right, we can treat the whole scar with these settings. If we see visible basals, just like the first video when we saw visible basals on the keloids, we move between 10 and 11 milliseconds and 10 and 11 joules. All right. So if we want to use the Co2re to flatten the texture of the keloid at the very end stage of this one, we should use the deep mode. We can use it individually, or we can use it with 5-FU or clobetasol propionate, applied on top of it. All right. So the settings of the laser should be using, well, I tend to use the hexagon shape. I mean, that's the most common one I use. I go at 9 millimeters, 5% density, and 70 joules energy. All right. And this is what the literature calls the held therapy. And it stands for high energy and low density. So this is being seen as the safest and the most efficient way to use a CO2 fractional laser in a scar. All right, so we have to use the held therapy. All right, so high energy and low density. At the very late stage of the keloid, if I just want to improve the texture because it's just a slight macule, I tend to use the Frax 1550. And for that, I use a 4.5 milliseconds pulse and a 55 joules square centimeter energy. All right. I normally tend to do between 2 and 4 passes of these settings. Okay, and once again after that we can do nothing or apply on top a drug. Okay, so these would be my recommendations to treat hypertrophic and keloid scars using different techniques such as intralesional drugs, cryotherapy, fractional ablative and non-ablative lasers, and also the IPL. Okay, so thank you very much for connecting to the webinar. I'll be here a few minutes more just in case you have more questions. There we go, and I'm just going to open. Let me unshare. And great, we move to the chat. So I can see your chat and I'm open to any question you may have for me. I can see that some people had some issues with the audio. Were you able to hear me?
Has been solved.
Okay, perfect, excellent. Do you have any question for me? Was everything clear? So as a summary, at the first stages, some people is asking if we will be able to see the video, if the video is recorded and will be uploaded. Yes, it will, so you will be able to see the video again. Thank you very much for asking. Hope in a few days it will be uploaded. So as I was saying, as a summary, the first phases in a hypertrophic or a keloid scar, it normally has a vascular component, and we have to address it with vascular devices, for example, the PR5030. After that, we can apply local cryotherapy with a tip. We can also use intralesional drugs, and at the end stages of the keloid, we move then to the fractional lasers, either alone or in combination with topical treatment. Okay, so that would be the summary of how to address hypertrophic or keloid scars. As a personal consideration, I wouldn't use fractional lasers in the active phases of a keloid because in my experience it may worsen them. I wouldn't use heat in the very early stages of a keloid. It can get worse. So once it's flat, then and once it does not cause any itch or pain, then we move to fractional lasers. Any other question here? So the literature these days, there is a big review regarding if it's better to combine techniques in the same session or to spare them in different sessions. So, and actually, it's been found that combining different techniques that do have different mechanisms of action do lead to a better result than using them spared. So don't be afraid to combine IPL, cryotherapy, intralesional steroids, or 5FU, and after that, a fractional laser. Okay? All right, so let me see the questions. Sharing, there we go. All right, I'm seeing right now the questions here. Wait a second, please. Right, any local anesthesia? No, actually, I don't use local anesthesia. I just use a numbing cream, right? Because I honestly think that the pain that the patient suffers from local anesthesia, uh, it's it makes not worth doing it. And by the way, if I inject a liquid that has water in it inside a scar, I don't know how it will interact with the lasers, right? So for that, I don't use local anesthesia. Another question is it useful for acne keloidales nuchae? For sure, definitely. It also has erythema, it also has hypertrophy, it also has keloids, it also has inflammation. So more than sure, this combination of treatments is useful for acne keloidales nuchae. Definitely. I mean, these techniques are actually useful for any kind of keloids, with the exception that the keloids appearing in the ear, they are normally recommended to be addressed with surgery. So the first treatment option for ear keloids, sorry, would be surgery. And one of the ways to do the surgery is using the core in its classic mode, in its surgical mode. And you can shave it from the base. After the shaving from the base, you can actually do cryotherapy and inject some 5-FU or steroids in the same base. I do actually have a video of it, and if you're interested in ear keloids, I can of course do another webinar or complement this one with this video I'm telling you. So yes, these techniques are useful for any kind of keloid except for the ones in the ear. All right. How many treatments do you do with the core? Since it is in the very late stages of the keloid, normally just one session. Why is the cryotherapy for? Well, the cryotherapy has anti-inflammatory properties, and it also makes it flattens the keloid. So this is another mechanism of action to act in a keloid. And by the way, it is also used as anesthesia to inject after that the intralesional drugs, right? So it's for the comfort for the patient, and also because we're using a different pathophysiologic mechanism to treat keloids. Any complications? Actually, no, except maybe some blistering because of the cryotherapy. But if you're gentle with it, no worries. What kind of intralesional steroids do you use, and in which quantity? All right, what I normally do is use pure 5-FU. It's sold in a 10 milligrams milliliter solution, and you can actually inject as much as 2 complete bottles, which are 5 milliliters per patient per day. All right, but most of the times I just inject little blobs of 0.01 milliliters per blob. All right, and I try to cover all the surface of the keloid. And it is not a complication, but if you use steroids, which I'm not very fan of, you may have, of course, hypopigmentation. You may also have atrophy around the keloid, and you may have additional telangiectasias. All right, so I tend not to use steroids, but to use 5-FU because it does not have these complications. Okay? Thank you very much for this webinar. Thanks to you for being here. What is age of new, old, and very old keloid? Well, that's a good question. I mean, new keloid, it's not new. I would say active. Active means that it's growing and it's causing itch and pain. All right. Old keloid is not red, it's not itchy, it's not very thick, and a very old keloid is an almost flat keloid and with no symptoms. All right, so it's not a question of time, but it's a question of semiology. Okay, what are your settings when you use erbium YAG laser? Well, actually, I don't have a erbium YAG laser, so I can't tell you that. I can tell you about the Co2re laser. I use 5% concentration, 70 joules, 9 millimeter spot. And for the 1550, which is an erbium glass, not a YAG, I use 4.5 milliseconds and 50-55 joules. Can we get the whole video in email, please? Well, Samantha will take care of you. This question has been answered verbally. Here's how you will get the whole recorded. All right, what kind? That's been answered. Which local anesthetic cream do you use? Well, AMLA is an option. AMLA is an option, but I tend to use tetracaine 4% and lidocaine 4% in a gel. All right, it's prepared by our pharmacy. That was answered too. What about phenols? We can use it with Co2re. I never use phenols because I'm not very fond of procedures that I'm not comfortable with. And what does comfortable mean? I mean, I like to take control of the things, so I prefer using not a peeling but a laser because I can exactly control the settings of a laser and I don't have to trust in my experience and in my eyes. So I do hardly ever use peelings to treat scars. Or there's another question here. For an inactive keloid in pediatrics, how would you approach manage? Well, that's a good question. The managing would be exactly the same, but of course, you know that kids do not tolerate treatments. So actually, what I normally do, sorry, is I go to a surgical room and I do it with general anesthesia. So that's the part of the treatment that I can do it in my office without anesthesia, which would be the cryotherapy and the vascular devices. I do it just in my office, but when I have to use fractional laser or intralesional drugs, I tend to do it at the surgical room. Cryotherapy as a spray is not indicated at all. Yes, it is if you don't have a contact tip. I mean, I first used the spray cryotherapy, but believe me when I say that it's more painful, it gives more blistering, and it does penetrate that much. So I would really recommend to buy a contact tip. You'll be very happy with it. All right, but yes, if you don't have a contact tip, you can go and use the cryotherapy as a spray. More questions? I can see a lot of activity here, and I hope I have seen all the questions here. Let me patients. Yes, I think I have answered everything. Do you have any additional question for me? Samantha, any additional question for me?
I think these are all the questions, Dr. Barco.
Okay.
Let's finish then.
Exactly. Perfect. I hope you all enjoyed the webinar. I hope you took clear ideas of how to address hypertrophic and keloid scarring. Don't be afraid to combine all these treatments in the same session. You won't see much complications, and for sure the patient takes benefit of different physiopathological mechanisms, which is very interesting in the field of scarring. All right, sorry. There is another question here. Can picosecundin laser be used to stimulate the neocollagenegenesis process? So the theoretical answer is yes, but I have to tell you that there's not much data published about it. Yes, we do have some studies regarding atrophic acne scarring, and yes, the pico lasers are helpful, but there are still only, as far as I'm concerned, 3 publications about it. They only speak about atrophic acne scarring, and I honestly don't think it would be useful for keloids. But let's wait for some months and see what other colleagues say about it. I personally don't have a picosecond laser, but I don't think it will be useful for hypertrophic or keloid scarring. There is another question here. Can it be used in pregnancy? We can use cryotherapy in pregnancy. From the theoretical point of view, we could use a laser, although it's off-label. And of course, you can not use 5-FU in the pregnancy, all right? You have to, after using the 5-FU, the patient must not get pregnant up until 6 months later, all right? You can instead use steroids for that, okay? So in pregnancy, we can use cryotherapy and we can use intralesional steroids, all right? No lasers, no 5-FU, okay? Any other final question? By the way, in my last slide, you have my email and my social media, so please, or even through Candela, please feel free to contact me and I'll be very glad to answer your questions. All right, so thank you very much for attending the webinar. I hope you take good messages to take home, and I'll be here to serve you. All right, and thanks to Candela again.